Hello everyone, welcome to another video. Today we're going to look at the introduction to gram-positive bacilli. So most gram-positive bacilli, or most gram-positive in general, is ambiguous, meaning that they are found within the environment, such as in the soil and in food produce. They are sometimes also found on the dermis of the skin. And we're going to look at four main gram-positive bacilli. So the first one is Listeria. Then we're going to look at Bacillus, the subspecies of Bacillus, Anthrax as well, and then also Coroniiform, Dipteropteria, and then also Nocardia. So Listeria, if you look at Listeria, they are ambiguous, like most are. The way you get this infection is through ingestion of this microbe, so in food produce mostly, and they're intracellular pathogen, and they're associated with impaired cell-mediated immunity, such as in HIV or cancer patients, or even lupus or any immune disease. And then Bacillus, they're also ambiguous, and the way you can get this is through inhalation, ingestion, as well as direct contact. Direct contact in humans are mostly the cause for Bacillus anthrax. And they are toxin mediated, and they're also spore forming, therefore they might be a bioweapon capabilities. Then if you look at the coronavirus bacteria, it is found within humans. The way that it is spread is through respiratory droplets, and it's toxin mediated. Nocardia is also ambiguous. And the way you get this is through inhalation or direct contact, and it's also intracellular pathogen and also associated with immunosuppression, such as HIV patients and things like that. So if we look at Listeria, it causes a disease known as listeriosis, and the way that you can prevent this is to cook your raw meats, to wash off your vegetables and fruits, and to keep your uncooked meats separately, and to avoid most of the dairy products, especially soft cheeses. They might be a high risk of carrying Listeria. And in adults, it can cause acute sepsis. It can even cross the blood-brain barrier and cause meningitis, focal infections, endocarditis. And then in neonates, it can cause premature labor, stillborn, acute sepsis, meningitis, and things like that. And also, HIV patients are 500 to 1,000 times more likely to get a serious infection of Listeria. And then if you look at coniform or Corynebacteria, they spread through respiratory droplets, and they can cause a whole host of diseases, cardiovascular diseases. They can cause meningitis, kidneys, liver, or adrenal glands. They're toxin mediated, and they can also be invasive, such as endocarditis, septic arthritis, osteomyelitis. So it can be a quite wide spectrum of diseases. Then if you look at Bacillus cereus, there are two types of Bacillus cereus infections. It's heat-stable infections, and it is heat-liable infections. So the difference between the two is the hours. The heat-stable is 1 to 6 hours after eating some food or after getting some medical attention, and then heat liable is 8 to 16 hours, so it's a bit longer. And then the heat stable, you will get vomiting, whereas with also diarrhea and abdominal cramps, but with the heat liable, there won't be vomiting. And then the symptom duration for the heat liable, it is a lot longer, 12 to 36 hours. For the heat stable, it is only 10 to 24 hours. So it's a lot longer. And then most of the infections are through medical equipment, which is infected, such as um, eye drops or things like that. Then it can cause um, infections within the patient. And then the next bacillus gram positive bacteria is bacillus anthrax. And they are mainly associated with causing disease in herbivores. But they can also infect humans. And there's three ways. It's through the gastrointestinal tract, which is very rare. It can also be like this black eschar, which is through direct inoculation of the anthrax. So it's on the dermis of the skin, or under the dermis of the skin. And then the most common and the most dangerous is through inhalation of these spores. And also with humans, the way that it normally you normally get it is through direct contact with a dead herbivore or a dead herbivore. And also it's spore forming, so it can be used as a bioweapon, and a lot of attempts have been made to make it a bioweapon. I think the next one is nocardia, which, if we remember, it's also ambiguous, and it can cause a pulmonary disease, which looks a lot like TB, and it needs a molecular identification or micro identification through maybe culturing or through PCR and things like that. And the risk factors, once again, the same as with your listeria, is immunocompression is a big risk factor, but also the use of corticosteroids and transplants can make this disease a lot more common. And transmission is through inhalation or direct contact. So thanks for listening to this video on gram-positive bacilli. Cheers.